Alright, so for our next technique, we're going to be doing a lateral mobilization with movement for the elbow to help with elbow flexion and extension. So what we're going to do is we're going to basically be stabilizing the humerus as the patient is in either flexion or extension, and a little bit of that range of motion, whichever one we're going to be trying to be improving. So if we're going to have our patient here going into flexion. So we're stabilizing that humerus. We're going to be using our opposite hand to provide that lateral glide right at the elbow joint. We're going to try to get as close to that elbow joint as we can. So we're going to be going from medial to lateral, so right around where that medial epicondyle is. We're just going to be providing that lateral force and asking them to go into flexion and then back down. We'd have them go through a few repetitions, again, going in pain-free range of motion. As you can see, this could be a little difficult as they are going through the actual range of motion, so as always, you can try to supplement that with a band or some sort of other stabilizing force. The next technique is going to be another mobilization with movement to help with either gripping or extension-based pain. So this one we're going to need a band. And what we're going to do is we're basically going to be using the band to provide the stabilizing force as the glide as the patient is going through either a gripping or extension, wrist extension motion. So for this, we're going to place this underneath the patient's elbow, and then around, you can go ahead and relax, and then around our shoulders. And then, let's say this patient is having difficulty with gripping. What we're going to do is we're going to give them a towel or something to grip. They're going to be relaxed. Here, we're going to continue to stabilize the humerus. And then we're also going to place a little bit of pressure on the distal forearm as we pull up with the band to provide more of a superior lateral based glide. So right on that same position we were on earlier, but this time we're just using the band to provide that glide, and then we would just ask them to perform repetitions of gripping. Or if we have somebody who's having maybe some carpal tunnel type pain, so pain with extension, repeated extension, we will have them do a gripping motion. We'll provide that glide, have them go into a gripping motion, and then wrist extension, and then back down.